This well-life presentation will be on the 10 principles of neuroplasticity and how they can influence stroke recovery. To gain a better understanding of neuroplasticity, let's break it down. Neuro relates to the nerves or nervous system, and our brain is a part of the nervous system. Plastic is something that is easily shaped or molded. It is adaptable to change. The suffix ity means the quality, state, or degree of being. When we put this all together, it makes neuroplasticity. So, neuroplasticity is defined as the ability of the nervous system to change its activity in response to stimuli by reorganizing its structure, functions, or connections after a stroke or traumatic brain injury. Principle number 1: use it or lose it. When you are not actively using or practicing an ability, the connections in your brain begin to deteriorate or weaken. Principle number 2: use it and improve it. The more you use it, the stronger those connections in your brain will become. And the more you are using it, it will also increase both your performance and your speed. Principle number 3: specificity. The way you train your brain matters. There are specific ways to train your brain which will help increase those connections in your brain. Specific ways include learning something new or relearning an old skill in a new way. Principle number 4: repetition. To start plasticity and create long-term changes in your brain, you need repetitions. It is estimated that thousands to tens of thousands of repetitions are needed to start plasticity. Principle number 5: intensity. Plasticity also needs intensity to bring about change. Research shows that the more intensive a therapy program is, the more likely a person is going to achieve their goals and maintain those changes. Principle number 6: time. Different forms of plasticity occur at different times during recovery. So the earlier you start providing opportunities for the connections to recover, the better. There are windows of time where progress happens at a faster rate, and starting early will help reduce behaviors which are not adequate for the situation. Principle number 7: salience. Training must be important for you to introduce plasticity. Our emotions influence treatment, including how effective it is and how our long-term memories are made. So using hobbies or interests for therapy will make learning new things easier. This is a critical step in healing the brain. Principle number 8: age. The younger your brain is, the more adaptable to change it is. However, connections in our brain can adapt and grow at any stage in your life. You are also more likely to see greater effects if you are active both physically and mentally. Principle number 9: transference or generalization. When you are working on training skills, it can also activate other nearby connections in your brain, even if those connections are untrained or not targeted. This is called transference. Generalization is learning something in one situation, but using it in other situations. Interference. Neuroplasticity means the brain is always learning, but sometimes knowing the difference between what is good and what is bad is challenging. Make sure you are practicing things that will promote positive change rather than negative change. Compensatory behaviors occur when there is a loss of function and you have learned a different way of doing things. But this way may not always be the best way, and you may have to unlearn some of those compensatory behaviors to regain a skill. Thank you.